Do you know when to start checking for prostate cancer? No need to look around, this question is for everyone. Prostate cancer, a topic that might seem distant, is closer than most of us realize. It's not just a statistic, it's a reality that affects many men around the globe. Every year, thousands of men are diagnosed with this condition. However, early detection can play a significant role in managing it effectively. This is why we're here today, to shed light on this critical issue and equip you with knowledge that could potentially save lives. Our goal is to provide you with a comprehensive guide on how to perform a self-exam for prostate cancer at home. We'll walk you through when to start, how to prepare, and what steps to take if you find something unusual. Knowledge is power, and in this case it could be a lifesaver. The first step to prevention is awareness. Now let's dive into when and how to start checking. Prostate cancer doesn't discriminate with age, but do you know when it's most appropriate to start checking? This is the question on many minds, and the answer might surprise you. The generally recommended age to start screening for prostate cancer is 50. However, this is a guideline, not a hard and fast rule. Why 50, you might ask? Well, studies show that the risk of prostate cancer increases significantly as men age. In fact, about 6 in 10 cases are diagnosed in men who are 65 or older. But that doesn't mean younger men are immune. Prostate cancer can and does affect men in their 40s and even 30s, though it's less common. Now, it's important to note that there are risk factors that might necessitate earlier checks. For instance, if you have a family history of prostate cancer, especially if your father or brother was diagnosed at a young age, your own risk is higher. African American men are also at a higher risk and should consider starting screenings earlier. Another key factor is your lifestyle. Are you a smoker? Do you have a diet high in red meat and low in fruits and vegetables? These factors can increase your risk. Even your weight plays a role. Men who are overweight or obese have a higher risk of developing a more aggressive form of prostate cancer. But why is it so important to start checking early? The simple answer is this: early detection is key in treating prostate cancer successfully. When you catch it early, prostate cancer is one of the most treatable types of cancer. It's slow-growing and often doesn't spread beyond the prostate gland itself. The 5-year survival rate for localized prostate cancer is nearly 100%, but if it's left undetected and untreated, it can spread to other parts of the body and become much harder to treat. So, when it comes to checking for prostate cancer, earlier is always better. Be proactive about your health. Discuss your risk factors with your doctor and decide on a screening schedule that works for you. And remember, self-exams are a crucial part of this process too. Remember, it's never too early to be vigilant about your health. Before you start your self-exam, there are a few things you need to do. First off, you want to ensure cleanliness. Wash your hands thoroughly. You don't want to introduce any unnecessary germs into the mix. Secondly, find a private space where you feel comfortable and won't be disturbed. This could be your bathroom, your bedroom, wherever you feel at ease. Now, positioning is also crucial. You might find it most comfortable to conduct the exam standing or lying down. The choice is entirely yours. Just make sure you're at ease. Lastly, and perhaps most importantly, you need to be relaxed. The more tense you are, the harder it will be to accurately perform the self-exam. Take a few deep breaths, clear your mind. Remember, the goal here is to get a clear understanding of your own body, to identify any potential changes or abnormalities. Preparedness is key to conducting a successful self-exam. Now you're ready to perform the self-exam. Here's how. Let's dive right into it. The self-check is a simple procedure that involves examining the prostate gland for any abnormalities. The prostate is a small, walnut-sized gland that sits just below the bladder. It's part of the male reproductive system, and it's essential for the production of seminal fluid. To begin the self-examination, first, ensure your hands are clean. Then, find a comfortable position where you can easily reach the area you need to examine. You might find it easiest to do this while lying on your side or standing with one leg elevated. Now you're going to use your index and middle fingers to feel the prostate. But before that, you need to apply some lubricant to your fingers to make the process more comfortable. You can use any water-based lubricant available at your local pharmacy. Next, gently insert your lubricated fingers into the rectum and feel for the prostate gland. It's located about 2 to 3 inches inside. What you're feeling for is a small, round bulge. It should feel firm but not hard, and smooth without any lumps or bumps. Now don't be alarmed if you can't find it right away. It can take a bit of practice to locate the prostate, and that's perfectly normal. The key is to be patient and not to rush the process. As you're feeling around, pay attention to any areas that feel different. These could be hard spots, lumps, or bumps. Also, note if there's any discomfort or pain when you press on the gland. These could be signs of a problem and warrant further investigation. Remember, the goal here isn't to diagnose yourself. Instead, it's about becoming familiar with your body and noticing any changes that could indicate a problem. If you do find something unusual, don't panic. There are many reasons why the prostate might feel different, and not all of them are serious. But it's always a good idea to get it checked out by a healthcare professional. It's also important to note that while a self-exam can be a useful tool, it's not a substitute for regular checkups with your doctor. Medical professionals have the training and expertise to identify problems that you might miss, so don't skip those regular appointments, even if you're performing self-exams. So, that's it. That's how you perform a self-exam for prostate health. It might feel a bit strange at first, but with practice, it will become easier. And remember, by taking this proactive approach to your health, you're taking a significant step in catching potential problems early. Remember, practice makes perfect. The more familiar you become with your body, the better. So, you found an abnormality during your self-exam. What's next? First and foremost, let's take a deep breath. Discovering an abnormality can be a bit unsettling, but it's important to remember that not all abnormalities are indicative of cancer. They could be signs of other benign conditions such as prostatitis or an enlarged prostate. Nevertheless, it's crucial to take action. Don't let fear or uncertainty hold you back. Reach out to a healthcare provider as soon as possible. This could be your primary care doctor, urologist, or a local clinic. It's their job to guide you through the next steps. When you contact them, be prepared to give a detailed account of what you've found. Include the size, shape, and location of the abnormality, and whether you've noticed any other symptoms, like discomfort or changes in urinary habits. This will help them assess the situation and decide on the appropriate course of action. Remember, time is of the essence. The sooner you get it checked out, the better. But while you're waiting for your appointment, try not to lose sleep over it. Worrying won't change the outcome, but being proactive and seeking medical advice can. Your doctor may decide to perform further tests to determine the nature of the abnormality. These could include a digital rectal exam, a prostate-specific antigen, PSA, blood test, or perhaps even a biopsy. These tests can provide a clearer picture of what's going on and help your healthcare provider formulate a plan. If it turns out that the abnormality is indeed a sign of prostate cancer, remember that early detection is key. Many forms of prostate cancer grow slowly and may not cause significant problems. However, some types are more aggressive, and early treatment can make all the difference. Your health is in your hands. Don't ignore any signs. Prostate cancer can be a silent enemy, but you have the power to fight. We've covered a lot of ground today, and it's crucial to remember the key points. Prostate cancer is a reality for many men, and early detection is the best form of defense. Regular self-examinations are a vital part of maintaining your health, and knowing when to start checking is just as important, around the age of 50 or 40 if there's a family history. We've learned how to prepare for and perform a self-exam, and it's a simple process that can be done at home. If you find any abnormalities, don't panic. Reach out to a healthcare provider to discuss your findings. They're there to help. Taking an active role in your health isn't just about prevention, it's about empowerment. Remember, you're not alone in this fight. Together, we can beat prostate cancer.